Hey, Pinellas County. Welcome to the first edition of Mythbusters. Today we're going to talk a little bit about medication administrations through IV setups. So one of the things we want to discuss is the myth of, well, do we need to pinch the IV line, or can we just push the medication and make sure that we're pushing at the right rate with having someone squeeze the bag so we don't get backflow into the line. So I got Caitlin here with me today. What we're going to do is show you kind of an example of how the medication should be pushed versus kind of what we've been hearing has been going out in the system. So what we're using here is a simple example of Zofran. We're going to give 4 milligrams of Zofran, which is 2 cc's of fluid, IV push. And how fast do we want to give that? Well, we want to give that at a slow IV push rate, correct? So we're going to open up the IV line, make sure that we got a good flow, which we do. So we have a good flow going, and then as Caitlin pushes the medication, what we should see is the medication actually go down the line and not be pushed back up into the bag. So as you can see, the fluid's going down into the patient the way it's supposed to. The medication's being kind of diluted as it goes in, which is exactly what we're looking for. And once the medication is completed, we want to go ahead and flush that medication in as usual. Hey, Pinellas County. We're back again with another edition of talking about some IV administration stuff. So what we're going to talk about today is if we have to facilitate and abate a patient. So the first medication that we're going to be giving is going to be fentanyl. So our fentanyl dose is 2 mics per kilo, but when we're talking about giving medications, we want to discuss, the IMAC. So the intervention that we're going to perform and the medication and cross-check it with our partner. So we would talk about, hey, what's the medication that we're giving? What's the dose going to be? Make sure we confirm that dose with the other paramedics on scene or your partner if there is no other paramedics on scene. You're going to talk about side effects, indications, and you want to look at the desired effect for the patient. So with fentanyl, you got to be careful because if you push fentanyl too fast, what happens?
Get some chest wall rigidity.
Yeah, you'll get chest wall rigidity, which is going to make it kind of difficult to ventilate a patient, correct? So the medication that we have drawn up here is etomidate. We took an average 100-kilo patient, and we're going to give that medication. So a 100-kilo patient at the dose that we give etomidate, which is
0.3 milligrams per kilogram.
0.3 milligrams per kilogram. Excellent, thank you. So we're going to give that medication, so it's going to be 15 cc's or 30 milligrams. So we're giving the medication, we have our IV running, and look, the medication's not backing up into the line, so we're going good here. We're going to open it up a little bit more, though, just so we get the fluid into the patient. Given that medication, we'll just talk a little bit more about the side effects of giving etomidate too fast. So if you give etomidate too fast to a patient, Caitlin, I'll have you jump in on this one as well. What happens to that patient if you give the etomidate too fast?
It causes them to have some trismus, which is going to make it kind of hard to intubate them.
Right. So once again, if we give fentanyl too fast, we get chest wall rigidity, which makes it difficult to bag. If we give etomidate too fast, it's going to make their jaw kind of clench up on us, and we're not going to be able to put an airway in place. So that's why we want to make sure that we're following the protocols on giving these medications at the right rate. And once the medication is all the way in, it usually takes about 90 seconds for this medication to kick in, and that's when the patient should start to display some symptoms of being, or going under a little. Okay, so as Caitlin pushes the etomidate, I want to talk about another drug that we want to give that's slow, that's going to be coming back this month, and that's going to be Cardizem. Yes, you heard it right. Cardizem's coming back finally. All right, so Cardizem. Max dose of Cardizem for Pinellas County is 20 milligrams total, right? So normally you're going to hear 0.25 milligrams per kilo, but once we max out at 20 milligrams, that's as much as we're going to give. And just like etomidate, you want to give a Cardizem slow IV push, usually over at least 2 minutes, and that way we get the desired effect, and we're not getting adverse reactions from the medication. Okay, so the next medication we're going to talk about is adenosine. So adenosine is the one medication that we will push IV fast, right? And the reason we need to do that is because it's got a half-life of 30 seconds or less. So we want to get that medication into the patient as quick as possible. So Caitlin has the medication drawn up already. Adenosine is provided in 6 milligrams in a 2 ml packaging. Obviously, we're going to do our MAC check with each other to make sure that we're giving the right medication to the right patient, and we're also going to make sure that the medication isn't expired and that the desired outcome that we're looking for. So go ahead, Caitlin, and we'll go ahead and give this medication. And as she's about to give, what I'm going to do is open up the bag real wide. But hold on a second. Let's talk to the patient real quick and let them know what's going on here, right? So we're gonna let the patient know what's going on, what's gonna happen to them. They're gonna feel chest pain, weakness, they might feel something kind of funny in their chest, they might describe it as. So make sure that patient's sitting down, lying down on the stretcher, whatever you've got to do, but let them know what's about to happen and the desired effect that you're looking for.
And
All right.
make sure we hit print.
And make sure we hit print on the monitor, absolutely, because we want to catch that conversion. Okay, so once again, this is another one of those myth-buster things. So we want to see, hey, if we give this medication and someone's squeezing the bag and we got it wide open, we got a 20 gauge AC or higher, are we going to get any backflow on this IV line, okay? So I got the IV wide open, I'm squeezing the bag, Caitlin's going to give the medication, rapid IV push. Oh, okay, so it looks like we had a little bit of a backflow into the line. So that could be an issue. So now she's going to give the 10 cc flush real fast. But what do we want with this medication? We want that medication to get into the body as fast as possible. So our drip chamber filled up and the medication kind of backflowed a little bit. So this may be that one time where we need to actually pinch the line to give a medication and then open it back up and allow for that fluid to flow through. So I guess this myth would be plausible or busted? What do you think?
Plausible.
Plausible. All right, so this one's plausible. Okay, so the next medication we're going to talk about is Levophed. Levophed is a drug that's not frequently given in the county. It's in our sepsis protocol, but so we like to kind of go over it on a more frequent basis. So Levophed is supplied in 4 milligrams in 4 ml. So that's 1 milligram per ml. The way we mix Levophed is we put 4 milligrams, the entire vial, into 1,000 bag of normal saline. So the first thing you want to make sure of is that when you are putting a medication into a bag for a drip administration, is that you do not hook up your IV fluid line yet. So you want to mix the medication in the bag. Caitlin's mixing the medication in the bag. She's putting 4 milligrams in the 1,000 cc bag. And then what she's going to do is she's going to kind of like gently agitate it. We don't shake any medications once we put it in there because we just want to get the fluid or the medication and the fluid to mix. So you can see that there's a pretty good fluid mix going on there. So now what she's going to do is she's going to go ahead and take the stat med that we have and go ahead and hook up the supply line, or hook up the IV line, and then she's going to go ahead and flush this out. Okay, and as you can see, we actually added some food coloring or some dye to this to the medication so that you guys could see it in the bag, because Levophed should not be brown, just so you guys know. This is for demonstration purposes only. Okay, so Caitlin's flushing out the line right now. This is a mini drip or 60 drop set, so it's going to take a few minutes for it to get through the system. Okay, so we've got that line primed now, so we can go ahead and shut that off until we get it hooked up to the patient. And then once again, we're going to perform our MAC check. We're going to verify that we're giving the right medication to the right patient. We want to talk about the desired effects that we're looking for, and this is going to be given mostly for a patient that is in some type of shock, where they're hypotensive, and we want to get their blood pressure up, okay? So we've talked about this in ACLS. If the patient's got a high heart rate and they're hypotensive, this is the medication you want to go to. If you got a post-cardiac arrest patient that is hypotensive and bradycardic, we can go with pacing first. So, okay, so the dosing for Levophed is 1 mic per minute, which is going to be equivalent to 15 drops on our set. We can go up with our medication up to 10 mics per minute, and you can adjust that every minute according to the protocol. So we're going to go and put this in here, and Caitlin's going to turn that to 15 drops per minute, and then we're going to go ahead and flow that to the patient. And once again, you know, just let the patient know that you're giving them medication. And of course, you're going to make sure you add your medication added, your medication label on there, put in the amount of medication that you put in, patient's name, your name, who mixed it, and that way that goes to the bag so that the hospital knows that you do have medications in that bag and it's just not a normal saline bag. Okay.